Hello and welcome to our third session of Rigicon Talks. My name is Alan West and I will be your moderator today. Today we're addressing some common myths and facts about penile implants, a subject that is often misunderstood, but critically important for men dealing with erectile dysfunction. I am super excited about our panel today. We are joined by three distinguished experts who will help clarify some common misconceptions about penile implants. First, we're joined by Dr. Rafael Carrion. He's a leading urologist and global men's health expert and thought leader specializing in sexual medicine and Peyronie's disease. Based at the University of South Florida, Dr. Carrion has authored over 40 peer-reviewed papers and is actively involved in various professional organizations. Welcome, Dr. Carrion. Next, we have Dr. Vijayant Gupta. Dr. Gupta is a prominent urologist in India, specializing in penile implants and male sexual health. He is well regarded globally for his expertise in high-volume implant surgeries and his dedication to advancing urological practices and men's health in the region. And finally, we have Mr. Vaibhav Modgil. Mr. Modgil is a respected urologist in the UK, known for his work in men's sexual health and penile implant surgeries. He practices at leading institutions in the UK and has made significant contributions to improving patient outcomes in urology. So let's start with Dr. Carrion. The first myth is penile implants are only for older men. Dr. Carrion, could you explain whether penile implants are suitable for older men or can be an option for younger patients as well?
I think this one's an easy one to tackle because historically, we have this image that a grandfather-like figure is the ideal patient where the penis function, such as erectile function specifically, doesn't work as good or just naturally declines when that's actually false. So it's a two-part myth, actually, meaning that if you stay healthy enough, you can preserve function later in life. But for the most of us, we basically accumulate luggage, if you will, other conditions that we didn't have when we were a teenager, 20s and 30s. And so our cholesterol goes up. We gain weight. We become a new onset diabetic. And so conditions do pop up. And so that's why you get that classic image that the older man is the only one suffering with ED. But not true. We do see younger individuals that suffer with ED. And here's the final caveat to link it all together for the question. When you really look at all the pros and cons of all the modalities to manage erectile dysfunction, it really is a good two-way conversation with the providers, such as the ones you see on the screen today, and the patients, because you navigate the waters to find out what is the best move. So if you have a 42-year-old or a 38-year-old where they have severe organic ED, and really look at the pros and cons of each modality, penile implant is on the table of options. Absolutely. It's not an old man's disease and modality of choice. It is everyone's choice. You just got to look at the pros and cons of each modality being offered. I'll pause there.
Thank you very much, Dr. Carrion. For our next myth, let's go over to Dr. Gupta. Dr. Gupta, there's a myth out there that penile implant surgery is only for severe cases of erectile dysfunction. Could you please address this common myth?
So I think penile implants, we don't really need to wait for the erectile dysfunction to reach a stage where the man has no erections, because it is not only about getting hard, it's also about maintaining size. It's also about maintaining the desire to have intercourse. So many times what happens is if the man waits too long to go for an implant and his erectile dysfunction has progressed to a level where he has no erections at all, he also ends up losing size. He also develops fibrosis in his sclera. He also ends up in stages where we're not able to get the implant all the way through to the glans. Plus, he also ends up in a situation where he has a lot of relationship issues and he develops a lot of problems in accessing intercourse or accessing sex. So I think a penile implant is a good option when somebody has moderate erectile dysfunction, where he is not very comfortable with medications, and he really does not need to go for that completely bloodless penis. We don't need to wait for that stage to arrive, because when he chooses an implant earlier, the implantologist or the prosthetic urologist will always be able to give him better results, will always be able to give him a better sizing. Plus, many of the patients also get natural erections even after an implant, by which they're able to, have success in their sexual life more, and maybe, get much more satisfaction in the relationships as waiting too long.
Great. Thank you very much, Dr. Gupta. On to our next myth, and this one is for Mr. Modgil. Our myth is that surgery requires a long hospital stay for penile implant surgery. Could you please walk us through a typical hospital stay for penile implant surgery? And is it as extensive as some people believe?
So I think there is a myth. There certainly is a myth that you have to come in for what is an extensive procedure and a really prolonged stay. Simply not true, to be honest with you. It is also nuanced by where you have your penile implant and the kind of service that center offers. So it does depend on the infrastructure, depending on the country and the institution that you're in. But here, for example, where we perform our surgery, we have actually been known to send some people who we deem fit enough home on the same day as surgery. And the vast majority of the patients that we operate on are home within 24 to 36 hours following what is normally a one-night stay in hospital. So there need not be a concern that a patient comes in for penile implant surgery and then ends up spending days in the hospital. It's simply not true. In fact, I would say that is very much the exception in terms of a normal patient journey.
Excellent. Thank you very, very much. That's very helpful. Our next myth, and this one's going to go to Dr. Carrion. Penile implants will make your penis shorter. So Dr. Carrion, is there a common concern that penile implants reduce the length of the penis, and can you address this, please?
I would say the concern is there, especially if the patients surf the internet, play active participants in the variety of blogs that are out there. But I think it's part myth and part misinformation. Knowing the principles of the anatomic features of the phallus will show you that the implant just goes into the two paired cavernosal bodies, meaning that if you have a large glans, well, the implant doesn't affect that, doesn't modulate that. It doesn't go into the head of the phallus, if you will. And so for the most part, it's simply education, knowing that expert prosthetic surgeons will maximize and make sure the sizing is 100% accurate in terms of fitting the paired cavernosal bodies. And then educating the patient, we make a small informal joke here in Tampa that if you have a small glans, that patient automatically brings a gift saying, you have totally matched the size of my natural erection. But if you have that patient that has a medium or large glans, that's the patient you educate a little more, because that's a low-hanging fruit in terms of educating them that, no, I haven't shortened it. With foreplay, with stimulation, with natural vascular engorgement of the glands, now your phallus looks quote unquote normal again. So it's mainly a misinformation, and just education helps navigate the waters in terms of allowing the patient to appreciate, no, you haven't shortened anything. Actually, it's just a different type of erection.
Excellent. Thank you very much. Okay, on to our next myth. Penile implants affect ejaculation or orgasm, and for that myth, we're going to go over to Dr. Gupta. Dr. Gupta, do penile implants affect a man's ability to ejaculate or achieve an orgasm?
So I feel this comes from the patient suffering from erectile dysfunction. So many times when the men are suffering for a long period from erectile dysfunction, so erectile dysfunction is just not about getting hard. Erectile dysfunction also affects their ability to enjoy sex, ability to last long, ability to, enjoy the sex completely. So many of these men have been living with this problem for so long that they actually forget how good an orgasm can be, how much they enjoyed it when they were younger and they used to have good erections. And many men, when they get an implant and they get back to the same stage, and after an implant, they come back and they say, doctor, I enjoyed my sex again like I was 18. Because now he's not getting soft. He's able to insert fully. He's able to do things to his partner that he always, kind of dreamt of. He's able to stay hard longer. He's able to hold his erection longer. And that's why many men actually are happy with the quality of orgasm that they achieve after an implant. In terms of ejaculation, definitely a penile implant will not increase your ejaculation time, may or may not cure your premature ejaculation, but definitely many men are confusing erectile dysfunction with ejaculation time. So many men don't stay hard that long to discharge over a period of time. So many men who are suffering from erectile dysfunction notice they're holding longer, they're staying harder. And that's why many men say that after an implant, they're able to last longer as well as get a more complete orgasm for both partners, for themselves as well as for their partners. Because now the partners also feel the full stiffness. They also know that, they can enjoy sex better and longer.
Thank you very much, Dr. Gupta. On to our next myth. Penile implants need frequent replacement. So, Mr. Modgil, how often do penile implants need to be replaced, and what's the typical lifespan of these devices?
So I think one of the main things to remember is the evolution of penile implants in the last 20 to 30 years. It's when you really drill down and think about this, it's quite remarkable just how good penile implants are now. They're cycled sometimes thousands of times, even before they're put into a patient, to ensure that they're robust and that the quality is there for the patient to have a positive experience. It simply isn't true that they need to be replaced often. If they are replaced, it tends to be because there's either been a complication, which thankfully is pretty rare, actually, if you look at all the figures. So they can be replaced for things like infection or erosion of an implant, for example. And those, unfortunately, are known complications of implant surgery, albeit very rare. When you start thinking about things like device malfunction, well, that's lower than it's ever been in the history of penile implants, because the manufacturers of penile implants have worked so tremendously hard on making the product so good. So I always tend to say to patients, if all goes well and your surgery is uncomplicated and you don't have any complications, I expect you to have your implant for a decade, maybe even up to 15 years. Is there some variability in that? Well, yes, there is. It's like any device, right? So it depends on how much you use that device, how you use that device, etc. But in essence, do they need to be replaced regularly? Absolutely not. Are they better than they've ever been? Absolutely.
Excellent feedback. Thanks so much for that. All right. On to our next myth, which is very near and dear to my heart, as Dr. Carrion notes. And this question, here's our myth. Inflatables are superior to malleable penile implants. Dr. Carrion, is there a significant difference between inflatable and malleable penile implants, and is one superior to the other?
Well, that's a quick and easy one to answer. Superior is such a vague, non-descriptive term when it comes to this subject topic. So superior would be absolutely false, because it's simply fulfilling two different prototypes and two different itemized lists of pros and cons. If you were to put on one side quicker surgery, less components means less risk. I'm never going to injure bowel, bladder, major vessels. It'll never have mechanical malfunction. You could start to see how the itemized list on a malleable looks like, and then inflatable, more natural physiology. I can inflate it when I want, I can deflate it when I want. So you could see there's simply a difference between the two. Superior, not at all. I stand by that. I defend it. I think it's two niche items where good dialogue with the patient, you find out what's best for that patient. I think they're both excellent options for the management of ED.
Dr. Gupta, how natural do modern penile implants look and feel, both for the patient and their partner?
So there have been now a number of studies which say that the satisfaction with the penile implants is not only about the look, but also about the function. So when the patients functionally become normal, they are satisfied, and also their partners are very satisfied. Definitely, the penile implants are not going to be as girthy or as looking as a natural erection. But what many men forget, or what many doctors forget to tell their patients, is that the penile implant acts as a support. And many times these patients will continue to have natural erection that fills out the penis when they are aroused and when they're having sex. So even without an arousal, even without an erection, the penile implants look natural, feel soft, and feel good to their partners. But the functional improvement that it provides to the patients adds so much to their quality of life, that even if there is some difference between a natural penis and a non-natural penis, I think it's okay. What men need to realize is that a functional hard penis that can give you good sex is always much better than a natural looking one that doesn't get hard.
That's great feedback, Dr. Gupta. Thank you very much. And on to our last myth for our session today, and this one is: penile implants prevent men from enjoying oral sex. So for that myth, we would like to go to Mr. Modgil. Can men with penile implants still enjoy oral sex, or does this interfere with the sensation of the penis?
Look, to me, again, this is a pretty easy and quick one to respond to. So in theory, there should really be no difference in how a man feels with a penile implant during intercourse versus what oral sex should feel like. So I think you have to be quite realistic with patients. And one of the things that I personally am not a fan of is describing a man with a penile implant as having an erection as such, because an erection is an organic phenomenon which involves the cavernoidal bodies filling with blood. And an implant doesn't give you an erection. It gives you uniformed shaft rigidity when you want, for as long as you want, as many times as you want. So if you then accept that, then there need not be any particular difference in sensation during oral intercourse versus penetrative intercourse or any other form of intimacy. And I think that's probably the best way to answer that question. And of course, it varies from patient to patient as well.
Thank you very much. So before we conclude our session, I would like to ask our panel members for any final comments they have regarding any of the questions that we asked today, or if they would like to make any concluding comments to our audience regarding penile implants. So let's go in reverse order and start with Mr. Modgil. Is there anything else you would like to add?
Yeah, so I think if I was to sort of summarize a couple of things, I think the first one would be to reiterate one of the points that Dr. Carrion made at the start of this conversation. You do not need to earn your implant. 10, 15, 20 years ago, there used to be conversations about taking patients through an exhaustive regime. Have you had your tablets? Have you had them for a year, 2 years? Did you try injections? How long did you do your injections? Did you try a vacuum device? How long did you do that for? It's not a test. We don't do that with any of the disease process. We don't. A diabetic doesn't have to take tablets for X number of time before they qualify for injections or any other form of intervention. So this is the same in my mind. If a patient comes along, yes, admittedly, the vast majority of patients should have tried tablet therapy because it's simple and it's got a relatively limited side effect profile and it's easy to do. But if a patient comes along and says, I don't really want to inject the penis every time I have intimacy, I don't want to have a vacuum device every time I have intimacy because I don't want to put it in my luggage for a weekend away or whatever it may be, it kills the spontaneity. Well, that's okay. As long as they made an informed choice, they're appropriately consented, then it goes back to that thing that Dr. Carrion was talking about. It's not just an old man's disease. All the options are on the table, and it's our job to speak to patients and make sure that they're aware of them and then come to a mutual decision about what's best for them. If that's penile implant surgery, then so be it.
Excellent feedback. Thank you so much. I think that was invaluable. Dr. Gupta, any closing comments for the audience?
Yes. So I want to take the question that Dr. Modgil talked about replacements. So many times I get patients who are carrying the latest iPhone asking about replacements, and I tell them that you change an iPhone every year, and and the phones are built to last for many, many years, but you just change them every year. But you are so concerned about the penile implant, which will most probably outlive your iPhone by another 10 years, right? Or maybe your car. So you buy a car and you change it after 5 years, but the construction quality of the implant is so good, it's going to last you 15 years. And when you buy a car, you never ask the salesman to guarantee you that it will never go down or never need repairs, right? And you still go ahead and invest in it. But the penile implant is going to give you a better ride than any car you buy, right? So I think the replacement or the repairs will be there with any mechanical device. But if you know what you're getting into and these implants are built to last, I think one should go ahead and look at the positive aspects of them lasting many years, rather than get scared about them maybe needing a repair. And even if they need a repair, they can be repaired easily. A good high volume implanter knows how to revise implants. So I think that's something I wanted to take about the replacement question. And one question that Dr. Carrion took about malleables versus inflatables. So in India, in Southeast Asia, malleables are done more than inflatables. And many of the patients here who have been constantly getting information from social media and from reports from the West, but there is a lot of tilt towards inflatables. Many of these patients believe that the inflatables are a much better option than a malleable. What I tell them this is that if you have a family of 4, then a van is going to be a better choice of a car than a Porsche, right? So you need to take, or you need to get what suits you and your affordability and your usability more than just going with a fancy Porsche ad, because those 2 seats are not going to fit your children. So that's what I tell my patients, and many of them understand the point, and then they go about choosing something which is good for them than just aping or seeing something that they don't understand.
Thanks, Dr. Gupta. That's great feedback for our audience. And then finally, Dr. Carrion, the closer. Any final comments?
I thought outstanding session. I wanted to go ahead and give commentary on the final premise, the final aim of what this is all about. A patient wants a modality that brings me as close to what I had and what I lost. So they did great commentary right now saying, you get a natural erection, that's not what an implant is. You just heard that. Excellent, excellent reminder that this is done by expert hands, and you could see global experts around. Now, they're not in every street corner of every country, but they're out there. So I challenge the patients, do your homework, find out who does this at high volume. You heard that terminology just now, because a penile implant, either prototype, put in well, healed well, outstanding satisfaction, outstanding return of function. And that's what it's all about. So that's what I wanted to give one final reminder. It is an excellent modality, but it has to be done in very able hands, because of course we're concerned about some of the suboptimal outcomes that are potential. And that's what I wanted to remind the crowd.
Fantastic. Thank you very much.
I'm so sorry, but I think it's such a brilliant point that I'd simply like to second it, because, it goes back to very similar rules to anything that anybody wants to be particularly good at. People will have heard about the 10,000-hour rule. Yes. So really important, as Dr. Carrion says, that the patient does their homework, So implant surgery is best done, like most surgery, in high volume centers. And that's where the best outcomes are reported. So I totally agree with this point.
Excellent. Excellent. So in closing, I would like to thank our distinguished panel for sharing your expertise and thoughtful insights and helping to debunk some of these myths about penile implants. Your insights have certainly been invaluable in helping men's health patients throughout the world make informed decisions about penile implants. And of course, thanks to our audience for joining us for this session of Rigicon Talks. We hope you found it informative, educational, and entertaining. And until next time, stay informed. And please know there are options available to help improve your sexual quality of life for you and your partner. Thank you very much.